If you guys know who Joe Rogan is, he talks about me all the time on his podcast about...
From this company, Ways to Well. Just, it's remarkable. Stem cells are remarkable.
I'm his stem cell lady when we repaired his shoulders. Stem cell is you have certain cells that turn into tissue. They turn into, brain, bones, and the developing fetus. These cells do not contain genetic material. They will not turn into an earlobe or an eyeball. We're shifting from the allopathic care model where everything is dictated, and now patients get to choose their avenue of care and how they want to be treated, what they want their outcome to be. So I'm going to go through these, and I just talk. I tell my stories about my cells, and I so thoroughly enjoy it. I'll give you a little bit of background. I'm a nurse practitioner. I started injecting in the 90s. In 1998, one of the orthopedic surgeons that I used to work with, his hands were too big, and he asked me to start doing his steroid injections in the emergency room. So I started doing joint injections, and the steroids made people feel better. They came in with knee pain. That was back when we had to go to the emergency room to get reimbursed by your insurance. That's how we had to work through it. And then it progressed to, I went to work for a research hospital, and we did bee venom. Okay. We also did cartilage stimulation. We would harvest cartilage from the rib and then grow it, or do collagen stimulation in the forearm and then inject that into the joints. And it just kind of progressed to a lot of different things. And each time we did a new product or a new experiment on a patient, we would get some benefit, but it was the length of time that benefit would be helpful that was, really, it would decide on if we would continue that or not. And so a few years ago, I started doing, we call it stem cells. That's a fancy word. Everybody knows it as stem cells. And stem cells, there's two different types. You have embryonic tissue. In the United States, we're not able to do embryonic or manipulated tissue. And I'll go into that in just a little bit. And then you have what we call perinatal tissue, which is the umbilical cord, and you can use part of the placenta or the amniotic fluid. And so in the U.S., that's what we do. That's what I do, is the Wharton's jelly and amniotic fluid. So I started out with my first one. What is a stem cell? A stem cell is you have certain cells that turn into tissue. They turn into brain, bones, and the developing fetus. It turns into those tissues that will present. It's genetically coded to be whatever that cell has been programmed to be. So as a baby grows, the baby's going to get a brain and a heart and bones and all the things that go with that. MSCs are mesenchymal stem cells. We call them mesenchymal signaling cells. Those are actually found in the umbilical cord tissue. These cells do not contain genetic material. They will not turn into an earlobe or an eyeball or anything else. They're only going to signal healing to whatever tissue they're injected in. So I have a whole lot of fun with this because I have people with a torn labrum, or one of my favorite stories is I have you may know him, Tim Kennedy. He has his torn ACL, torn MCL, torn PCL, and he calls, Danese, I've got to get an injection. We go do an MRI. His ACL is completely torn. PCL and MCL are slightly 30 to 40% torn. So I said, come in, let me get an injection, and let's get those signaling cells started. Let's get the mesenchymal cells, let's get everything started. Go into surgery, and then I'll inject you after surgery to help with healing. So we injected him about a week and a half before surgery. There's another part to that story that's funny, I'll tell you a little bit. So we do the injection, just put 1 milliliter of pure Wharton's jelly in. In the United States, we do not manipulate these cells, and we don't clone the cells. So just put the pure Wharton's jelly in, just 1 milliliter, tiny, tiny bit, and he has his surgery. He ends up only having to repair the ACL. The PCL and MCL did not have to be repaired because they had already started healing. The orthopedic surgeon said, whoa, if you hadn't completely severed this, I would have just braced you and sent you on your way. So 2 weeks after that, I do his injection, and he comes in off of his brace, off of everything, 2 weeks after surgery, picks me up, spins me around the room, and he's like, I don't know what kind of witchcraft sorcery you did, but I'm healing. So I injected him again and sent him on his way. And if you don't know who he is, he's we call him the real American hero. He's an army guy that's all over the place. He's an MMA fighter. The guy does not stop. He doesn't give a break. So just the ability to heal and heal that quickly was goals for him. So using the mesenchymal cells, and again, I'm going to use that term broad as stem cells, it can heal a tendon, it can heal a ligament, it can heal a labrum, it can heal the cartilage. Well, we're talking about regenerative medicine, and again, piggybacking off of that, when you go to your primary care doctor and say, my knees are hurting, they'll do an MRI or they'll do an X-ray and they'll tell you, you've got some osteoarthritis. Welcome to your 40s. Welcome to your 50s. This is part of aging. Sure, it depends on your lifestyle. It depends on what you did to protect, and there's genes play a role in that too. You have two options. Let's do a total knee replacement and let's keep you immobile for quite a while, or maybe I'll clean that cartilage up a little bit. That's my favorite one, is when they say clean the cartilage up a little bit. They're going to grind down and remove some of the cartilage and set you up for some pain later. Once you have surgery, you can't ever undo surgery. You can't ever undo that scar tissue. When you've manipulated a joint, you can't go back to where it was before when it was a virgin joint. So whenever we're talking about surgery prevention, and I love my orthopedic guys. I did orthopedic surgery for a very long time. I love my ortho guys, but to a hammer, everything's a nail. So if you come in, doc, I've got some knee pain. Oh, let me scope it and see what's going on. That just creates a whole host of scar tissue. Scar tissue is painful. Scar tissue worsens over time and just, again, sets you up for pain later. I'm on the side of, okay, let's get an MRI. Well, you got a little inflammation. We've got a little tear. Let's do something now so we can prevent surgery in the future. If you're lifting weights, I make a joke all the time. I say I want to die young as late as possible. I want to be the 85-year-old in the gym having sex whenever I want to. I don't want to be the 85-year-old crinkled up in the nursing home in joint pain because no one ever addressed it. No one caught me early enough to fix that. So, I work with a lot of pro athletes. And if you guys know who Joe Rogan is, he talks about me all the time on his podcast about I'm his stem cell lady when we repaired his shoulders. That's fun because people like him just get a shot and go. Keep going. There's no downtime. 72 hours, take a vacation. Go do a weekend and relax somewhere and let the cells do their work. My pro athletes, my people that do bodybuilding, they don't have time to take 6 months off and recover from, a big surgery or cartilage graft or something that is debilitatingly painful that they lose all their progress. So anyway, back to what is a stem cell. A stem cell is, in our case, what I specifically use is mesenchymal signaling cells. This particular cell tells your body, it tells that tissue to heal and repair. One of the things it will not do if you're talking about a joint, or specifically, let's just mention the ACL. If I get an ACL tear and it's a percentage tear, like there's still some connection, I'll still inject because it's very likely that the healing will take place. I use a very tiny needle, 1 milliliter only. I don't even use lidocaine, and I tell people all the time that's the most anticlimactic injection you'll ever get. Just a little poke, and then usually it heals very well with one injection. I never promise that because, and I'll go into detail in just a second, it depends on how your body receives the cells. But those signaling cells can tell the tendon, the ligament, the cartilage, the muscle to heal because their only job is, as a signaling cell, is to signal to heal. In the umbilical cord, if the mother is injured or if the baby's injured, the cells will travel from the umbilical cord to the mother or to the baby. So I make a joke that I can put in your earlobe and your body's going to send it wherever it needs because of inflammatory cytokines. When you have an injury or inflammation, your body sends out signals. It says, I am hurting here, send help here. And this is always fun because people come to me, they're like, yeah, my pro athletes or my UFC guys are the worst. I twisted my knee. Well, I also hurt my neck, my back, and my shoulder. And I'll tell them, I'll smile and say, well, tell me which one hurts the most and I'll inject that, but your body's going to assign it. No, you're going to assign the cells where basically where it sees most fit. So if you have a higher inflammatory cytokines coming from your neck, those cells are going to actually travel to your neck. So it's a lot of fun. I use my husband as an example all the time. Injected his knee. His knee didn't get a whole lot better, but his neck did. So, his body reassigned the cells. When that happens, or I suspect that's going to happen, I will use IV amniotic fluid. The IV amniotic fluid does contain some of the mesenchymal cells, not quite as rich as what's in the umbilical cord. It contains growth factors and exosomes. And the growth factors and exosomes help with the inflammatory cytokines. So I look at it like the Christmas tree effect. I'm going to hit the top first and let everything trickle down so that when I put the Wharton's jelly or the most concentrated mesenchymal cells, stem cells, in the joint that is hurting or the muscle that's injured, it tends to stay there. So, to use the bodybuilders as an example, they have a torn pec or a torn biceps tendon. Oh, they also have a tight hamstring. They've also got, back pain from putting the heavy load on. Those cells may go in other places. They're going to help, but they may not help exactly in that first spot that I injected. So using the IV exosomes, I have this routine that I do. I inject those first, and I wait about 2 or 3 minutes and just let it circulate through the body. That's all my imagination. There's no way to study it, but it's what I've been doing for a long time. And then I'll do the joint injection after that, because I imagine that the body's just loving all those growth factors and exosomes, soaking it all up. And then when I put it in the joint or in the muscle tissue, it stays. The minimally manipulated cells versus clone cells is basically the difference between what we can do in the U.S. and what other people do. There are outside of the country, there are people who take the cells and they clone them. So you can go to Tijuana or Panama, and I know specifically the Panamanian company, they do a wonderful job, but they clone the cells. And I use the example, if you take a piece of paper and you copy that piece of paper over and over and over and over, it loses some clarity. The function of the mesenchymal cell is to bind to a senescent cell, and it donates the mitochondria. So it's donating, we all learned that in school, powerhouse of the cell. We're donating that mitochondria to, it's making old cells, old damaged cells, new again. Well, if we're cloning that, copying that, copy, it's a weaker cell, in my opinion. You have a weaker response to the senescent transfer, or the mitochondria transfer to the senescent cell. So we don't clone our cells in the US. They have to be minimally manipulated, which means we collect them from, during pregnancy, they are donated. We track the mothers all the way through all their prenatal care. We screen them, make sure they have no disease states. And again, these cells do not contain genetic material, but we screen them all through, screen it again. It's elective C-section, so we collect the tissue and it is processed on site. The company I purchase from, I don't do that part of it. And then I purchase from them. So the cells have not been cloned. They have not been watered down at all. The company that I use sells the cells to me in the highest molecular weight and the highest concentration possible in the US. And I'm very particular about that. And you can cut it, and a lot of people do. They'll take half of that volume and put a little saline in, or just cut it down a little bit so you can hit 2 joints with the same milliliter. Yeah, it works. It can work. It can help a little bit, but what makes me sleep at night is knowing that I just give the 100% pure, the best thing I can give, and let them do their work. So, a lot of people go to those places and they get, it's touted that they get 1 million cells. There's no real way to calculate that. We do the molecular weight and count within that molecular weight and presume that it would be that volume. But every time we actually try to count, the volume varies a little bit because it's completely dependent on the mother and how many cells she had in that umbilical tissue. With the amniotic fluid, it's estimated to be about 2.5 billion of the growth factors, exosomes, all the cells that are in their most pure, and that's what grows and nourishes the baby. That's what protects and cushions the baby. So, I make a joke that I want those day 1 cells. I don't want my cells. So when I'm talking about stem cells versus PRP, day 1, brand new baby cells have not been exposed to the environment. They have not been exposed to the EDCs that we were just talking about, toxins. PRP is platelet-rich plasma. Some people call it platelet-rich proteins. Plasma, it's a sticky material. After you draw the blood, spin it down. It's a sticky material and it works great on small muscle tears, small joint tears. It's great because it's sticky and it keeps the tissue together. It does give you a little bit of the growth factors, but it's also whatever toxins you've been exposed to, whatever you have circulating around, you're going to expose that tissue to those in a concentrated value. So I'm not a big fan of PRP. I've done them both. I've done them together with my cells. I've done them separately. I have the best results when I just use isolated cells. You know, I make a joke. I don't want my 40 plus something year old cells, and I've had surgeries, I've had alcohol. I don't want those cells trying to heal me. I want the brand new baby cells that are day one. As we age, the cell volume actually declines anyway. So, you know, when people in their 20s and they're going to tell me I'm going to have PRP, I'm like, that's a good choice. If you have a muscle tear, small tear, that's a good choice because you probably still have plenty of cells that would heal you. Tell me at 45, no, let's do these cells because you likely don't have enough of your own to improve that healing or improve your outcome. What can stem cells treat? Stem cells, like I said, it treats any tissue. This has been a hot topic lately, and I seem to have a flood of patients in the last several months because I don't know where probably someone on social media, someone said, oh, these cells can cure everything because they're omnipotent. They can do just about anything. And there is some truth to that. And we're specifically studying on the pancreas to restart the pancreas so that we can have insulin, kidney function, heart disease. Dr. Ian White is studying specifically how this reduces the endothelial inflammation in heart disease. So yes, they can help with that. I don't tout that because I'm not personally studying it, but I have had so many of my patients that I treat one thing and there's a cascade of improvement. My favorite is, you know, seeing the calcium scores. They'll come in, they're just want an IV dose of cells or just the IV amnio just for health and health optimization. And we're also improving their diet, their stress, calcium scores, DEXA scans. I actually get to measure that stuff and see the improvement and quality of life. That's a really big deal. And I use Joe Rogan because he talks about me. You know, he did not want to have his rotator cuff repaired. He had had surgeries in his joints before. He absolutely did not want to have it repaired. Throw some cells in there. Took a few times, and he's like, man, I'm great. And if you see anything recently, he's talking about his knee. He's doing things with his knee he hasn't been able to do in a long time. This stuff is so fun, and it's not surgery. I jokingly call it it's my little hokey pokey dance. Just stick the needle in and turn yourself about and go enjoy your life because it works. I say that it works very well, but I have no guarantees because I give you good cells. I give you cells that are in their purest form, their highest molecular weight, but your environment plays a role. So I tell people all the time, I can give you the best of the best, but if your gut is inflamed, if you are not sleeping, if you are stressed, if your diet is terrible, you're not exercising, you're not doing your part, the cells are going to go wherever else your body assigns. So I have that happen a lot where people tell me, not a lot, let me rephrase that. I have that happen sometimes where people tell me, well, it didn't work in my knee, but man, I'm sleeping better. I just feel better. Like I'm thinking, and one of my favorite patients, she was like, my brain is clear. My back still hurts, but my brain is clear. And I'm all really okay with this because the pain was so bad. It was affecting my thoughts. It was affecting my brain fog and how good of a mom I felt. That was her complaint. So back pain was still there. Mental clarity was better. So she was exercising more. I work with a functional therapist and got her strengthening the core again. A year later, she didn't have to have back surgery. She's fine and she wasn't overweight. So, you know, sometimes it's just a little bit of a reset and giving a person an opportunity to heal. I have tons of stories. I've been doing this for a long time, but this has been the most fun I've had is with this product and these tissue and this type of tissue to inject. I've had a rush of, can it fix autoimmune diseases? Can it fix genetic discrepancies? Yeah, it can help with some symptoms. I will do the IV treatments for muscular dystrophy to help reduce the progression of the disease, but it does not stop the disease. If you are genetically predisposed and you are already expressing those genes, I can slow some of the progression. Multiple sclerosis has been a hot topic, and that's actually the reason why I got into this. My mother has multiple sclerosis, and so I was determined, I'm going to find a cure. We're going to do the things. And we've corrected her environment. We've corrected her hormones. She is off of all of her multiple sclerosis medications now. And at one point, she was bedbound and blind, and now she walks 3 miles a day and travels and just wears her readers. So I never tout that as the cells can reverse that. It was a process. There were a lot of changes that had to take place. Diet was the biggest thing. What you put in your body sets your environment. That is, you're gonna heal because you're putting the good fuel in, or you're gonna constantly fight the bad fuel. The cells will help you constantly fight, absolutely. But if you're doing that part on your environment, the cells will do what they're supposed to do for your joints and all the other things that we use our cells for. That was about it. I left a lot of room for questions because everyone has when I do my talk about what we do, all the questions pop up, so I wanted to.
So do you find that the CRP levels drop after stem cell?
Yes, I do. I have homocysteine, CRP. I love to get those data points. If I let my patients choose their labs, we're just cash pay only, so I recommend, hey, let's do this. Sometimes if I suspect it, I'm like, I'm going to cover the cost so I can just prove my point. And yeah, I see big improvements on that. We see improvements in Hashimoto's and TPO antibodies too. That's interesting to me because I can't tell if it's the cells or if at the same time we've corrected diet and stress and sleep. I harp on sleep a lot. I harp on stress management a lot. If your body's in a state of you're just trying to survive, you're not going to repair, you're not going to build. I use the analogy, if you have a leak, you're not going to wipe up the water first, you're going to go plug that leak. Then you're going to clean up the water. If you have something that your body's fighting off and fighting hard daily, correct that first, and then we can use the cells to clean up everything in between.
Have you ever treated lumbar facet joint hypertrophy?
Yes, not specifically. I do not inject into the facets. These cells love a rich, blood-filled environment. So we don't put them in I put them in the knee joint because there's enough fluid in there you get that immediate cushion effect with the tissue matrix. But in the facets, it's a little different. I do it in the paraspinous muscles closest to the site of pain. And I put about 0.5 milliliter on each side. And I imagine that the cells envelop that area. That's usually what I have happen. If I inject the cell where they're cryopreserved or cryo-frozen, they're stored at -84 degrees. So I have the special freezer, all the special transport. And then I thaw them right before I inject. So they are very cold, just not frozen. When I inject them, so people get a little bit of a discomfort from the temperature change, but as the cells warm up, I tell people that's when the cells wake up because they're waking up and looking for their signals. They're looking for nourishment. They're looking for that communication of where they're supposed to go because that's their only job. And again, they don't contain any genetic material, so their only job is to just go and donate that mitochondria. So the FDA does not want me to say the cells travel throughout the body. And I'm like, but if it's in the umbilical cord and it helps the mother and the baby, how do you think they get there? It doesn't, it's got to travel. It's got to go to those places. So there's within the Wharton's jelly, it does contain the mesenchymal cells, mesenchymal signaling cells, growth factors and exosomes, but it also contains tissue matrix, and tissue matrix gives you that immediate cushion effect in the joint. So I have people that will come in just limping with osteoarthritis, pain. I would say knees and shoulders are probably my favorite because you just get almost an immediate relief. And I had a gentleman, he's a sheik, like a very high-powered person. He came with a few of his wives and his cat. And he shows up in the office and he was like, I have to come see you. I have people that fly all over the world to come in. And he was very, very stoic, didn't trust me. And I'm a woman. And he's like, oh, and you're not a doctor. So I'm like, no, I'm a nurse practitioner, but that was all explained to you before you got here. And he said, okay, but my friend told me that this is the best thing that you can do. And he had a large joint. It was very swollen. I actually ended up injecting 2 milliliters into his joint. And he stood up and immediately started squatting down and doing all these things and trying to do jumping jacks. He was like, I haven't done this in 10 years. And I was like, oh, that's not what I want. I wasn't expecting that. And he messaged me about a week later. He feels better. About a month later, he feels better. 6 months later, it's been almost 2 years. And he's like, when do I come back? Are you having pain? No. What does your MRI say? My MRI says I don't have osteoarthritis anymore. So I can't make those claims. I can just tell you what has happened. These are the results I've had. I have had some patients that, hey, it didn't work. You're a surgical candidate, and I'll send them. I have a fantastic orthopedic surgeon that I refer people to. I have a spine surgeon that I refer people to. Sometimes we're too far gone. The cells are only going to do so much. But if I can catch you on the side of, hey, we don't need surgery yet, that improves your outcome. So I have a pretty famous comedian too. They told him he was going to have neck surgery. And so he had some right arm pain. He had some loss of feeling in his last 2 digits. And he's like, I'm so terrified of this surgery, because they wanted to do the anterior approach. And he was just absolutely terrified. He's a comedian. That could affect his voice. He didn't want to have the scar. It was a really big deal. And I was like, well, let's do this. I'll do it once, maybe twice. And then if it doesn't work, we have to defer to surgery. I did 1 injection, 1 milliliter injection in the paraspinous of the cervical spine. He went back and got his MRI. Nerve root completely repaired. No numbness, no tingling. It's been about 18 months, and I'm actually part of his joke now. So it's so much fun. And this is, again, to piggyback off of that bifurcation in healthcare, people can choose this. You don't have to go have surgery. You may have an option to do something else. The other thing that drives me bananas, and I didn't know any better, I used to do it, steroid injections. Somebody comes in, oh, my knee's hurting. Let me get a steroid, and a steroid, and a steroid. And I'm coming every 6 months to get this steroid. The steroid absolutely wrecks your gut. It absolutely wrecks your metabolism. It just wrecks a lot of things on your adrenals. You have side effects that go with that. But the worst part for me is it degrades your cartilage. You get no benefit from it. You get immediate relief, but there's no healing that takes place. When you take cells like these and they donate the mitochondria, you're actually getting healing. So I have people that'll come in, different stages of osteoarthritis, different stages of injury, and we do 1 injection, wait a few months, do another injection, wait a few months, do another injection. By the 3rd one, it's completely reversed, and they're lifting weights, competing, doing all the things they want to do, golfing. I have a lot of fun. I have a gentleman, if I mimicked him, you would know who I was talking about. But all he wanted to do was play golf. And he tells me he can swing his golf club now. So sometimes it's just a quality of life. And he was not a surgical candidate because of his age. And they just said, well, take some ibuprofen for the rest of your life and deal with your shoulder pain. So pop a milliliter in each shoulder. He's playing golf every day, on top of the world. So there are options out there, but allopathic doesn't necessarily entertain those because insurance doesn't cover this. Patients have to come out of pocket for it. So I have 2 in Texas. Right now we're in Texas. Texas only, Houston and Austin. We're about to go throughout the nation. I'll be in 10 states hopefully by the end of the year. Florida is one of them. Florida's a little hard. Well, I've been working on that one for a little bit, and they're a little more challenging than others. But yeah. Anybody have any other questions? Well, hopefully I got us back on schedule for you. I think if anything, if I put my website up here if you have any questions or anything comes up. And thanks, guys.
For more insight into hormonal health, why not explore our channel? We've got a wealth of content awaiting your attention, and you can also visit our website at balancemyhormones.co.uk. So, this is Mike from Balance My Hormones, your beacon in the fascinating world of hormonal health. And until next time, remember, knowledge is power, and your journey to wellness starts here with Balance My Hormones.